CNA test prep questions from Quizzprep. Question 1. Which of the following would be an inappropriate action when providing hygienic care to a resident? Thoroughly dry skin to prevent breakdown after washing. Encourage the resident to participate in their hygienic care. Examine the skin for any areas of skin breakdown or injuries. Apply lotion to the body with extra coverage between the fingers and toes. Question 2. It is time to bathe an Alzheimer's patient who has had visitors in the room for most of the shift. Which of the following is the most appropriate action for the nursing assistant to take? Ask the visitors to step out until the bath is complete. Ask the patient when you should come back. Ask the charge nurse to speak with the visitors. Perform the bath as your first task the next day. Question 3. The nursing assistant is helping a quadriplegic resident eat dinner. Which of the following actions by the nursing assistant is inappropriate? Offer the resident small bites and allow time for chewing. Sit at eye level with the resident. Encourage personable conversation with the resident. Offer the resident drinks only after all the meal has been consumed. Question 4. A resident is often late to physical therapy because she is very slow at feeding herself during breakfast. What is the best action for the nursing assistant to take? Withhold breakfast until after physical therapy. Encourage her to eat faster by taking her plate away when it's time for her physical therapy. Bring the resident to breakfast earlier. Begin feeding the resident breakfast. Question 5. Which of these is an incorrect procedure for shaving a resident? Use a towel around the resident's chest when shaving his face. When shaving the face, start from the chin and shave upward toward the sideburns. Shave upward on the neck. Before shaving a resident, check on his/her records and with the nurse to be sure the resident does not have a bleeding problem. Question 6. Which of these is an important fact that is easily overlooked or forgotten by caregivers and facilities in reference to resident bathing needs? Beliefs about bathing frequency differs among cultures. The caregiver needs to use proper body mechanics to avoid injury when bathing a resident. The water needs to be at a safe temperature for bathing. The resident should be rinsed and dried thoroughly. Question 7. Which of these may depend on facility rules when performing nail care on a resident? The policy on cutting toenails. Nails are easier to trim if the feet or hands soak for 10 minutes before starting. When providing nail care, report blue or pale nail beds to the nurse. Nail care is best provided if the resident can sit in a chair, although it can be done with the resident in bed. Question 8. Which of these statements is false for the care of a resident's dentures? Dentures are very slippery when wet. Dentures break easily and are expensive to replace. Denture care is left to the resident so a care facility cannot be charged with negligence if something goes wrong. Dentures should be stored in cool water. Question 9. All of these are proper precautions for residents who are unable to move by themselves, except the resident should be routinely checked for pressure sores. The resident should be turned every 2 hours. The resident should be turned once on every nursing assistant shift. The resident should be left clean and dry from incontinence. Question 10. Morning care, sometimes referred to AM care, before the resident eats breakfast is important for which of these reasons? It adds to a resident's sense of well-being. It provides a pleasant appearance. It helps to decrease harmful bacteria. All of these are correct. Question 11. Key considerations for bathing residents include safety, privacy, and which of these? Swiftness in procedure, providing security, dim lighting, quiet surroundings. Question 12. Bad breath, tooth decay, and skin breakdown in the mouth are all symptoms of dehydration, dry mucous membrane in the mouth, overly moist mouth, inadequate amounts of toothpaste used when brushing the teeth. Question 13. An important, but frequently forgotten, consideration when providing hair care to residents is age, environmental conditions, race and culture, length of stay. Question 14. A small, watery leakage of stool could indicate which of these conditions: a medication reaction, a GI infection, pelvic muscle weakness, a fecal impaction. Question 15. Behaviors that may signal pain in the elderly may include all of these except excessive talking, not eating or drinking, insomnia, not participating in social activities. Question 16. Which of these is not a way to assist a resident to rest more comfortably and effectively? Remove all positioning devices so they don't interfere with sleep. Offer diversion activities such as reading, listening to music, and meditation. Pacing their ADLS, recreational activities, and visiting times to allow for proper rest. Create a quiet environment. Question 17. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. The patient's temperature should be taken 3 to 5 minutes after the drink was finished, 15 minutes after the drink was finished, 20 to 30 minutes after the drink was finished. Immediately, a cold drink should not affect the reading of most oral thermometers. Question 18. Another term for decubitus ulcer is perforation, ulcerated cyst, pressure sore, ulcerated tumor. Question 19. When monitoring a client's temperature, which thermometer will provide the least accurate reading? Axillary, rectal, oral, tympanic. Question 20. When transferring a resident from a wheelchair to stationary chair, the nursing assistant should stand to the right side of the wheelchair, in front of the wheelchair, to the left of the side of the wheelchair, behind the wheelchair. Question 21. A resident in your care is suffering chest pains. Which of these is not a direction to follow? Offer support and reassurance. Talk and act in a calm manner. Have the resident take small sips of water and place them in a downright position. Call for help immediately. Question 22. Which medical term is often used for burping, belching and passing gas? Flank, fascia, familial, flatus. Question 23. Which of these treatments would be best to decrease swelling? Cold compression, moist bandages, dry bandage pressure, heat compression. Question 24. Which of these is the least likely to signal impending death? Cold extremities, labored breathing, increase in appetite, unstable blood pressure. Question 25. Which medical position can be described as: the patient's head is elevated with legs either bent or straight? Fowler's position, Rose's position, Sims' position, Trendelenburg's position. Question 26. The best use of alcohol-based sanitizer is when helping with catheterization, when hands are not visibly soiled, when hands have blood from a cut, when hands are visibly soiled. Question 27. A resident is supposed to have 240 milliliters of juice every 2 hours. Which of these choices would be the most convenient to meet this requirement? 4 ounces can of juice, 8 ounces can of juice, 12 ounces can of juice, 5 ounces can of juice. Question 28. All of these might be used in dealing with contract years except hand roll, repositioning, bandaging, physical therapy. Question 29. Applying friction in the hand-washing process is very important. According to CDC recommendations, the scrubbing portion of hand-washing should take 60 seconds, any amount of time, as long as you scrub until hands feel clean, 20 seconds, 10 seconds. Question 30. All of these precautions should be followed when using a transfer gate belt, except Never using a frayed or worn transfer gate belt. Placing transfer belts around the resident's waist. Slightly rocking and pulling when using a gate belt on a resident in a sitting position. Not worrying about proper body mechanics. Question 31. Which of these is considered an accurate method for counting respiration rate? The resident counts to 60 while the nursing assistant counts respirations. The nursing assistant counts to 60 while watching the resident's chest. The nursing assistant watches the chest while the nurse looks at her watch to time 60 seconds. The nursing assistant looks at the resident's chest and a watch at the same time. Question 32. The CNA is assessing the pulse of a 9-year-old child. The CNA would expect the child's heart rate to fall within which of the following heart rate parameters? 90 to 140 beats per minute, 80 to 110 beats per minute, 70 to 100 beats per minute, 100 to 160 beats per minute. Question 33. Which of these tasks related to intravenous therapy is in the scope of responsibilities for a nursing assistant? Prepare the proper solution. Nursing assistants are not allowed to be involved in the intravenous process. Get the intravenous feed into the patient and then call the supervising nurse to assess. Watch the drip and report any problems. Question 34. Which of these statements is true for restorative nursing? Restorative nursing is out of the scope of duties for a nursing assistant. Restorative nursing returns the duties of the resident's exercise plan back into the hands of the family. Restorative nursing allows the resident to return home and do self-care. Restorative nursing helps a resident gain and then maintain functionality and well-being. Question 35. Which of these is included in the Resident's Bill of Rights? The right to be informed about the facility's services and charges. The right to have your family determine your plan of care. The right to have transportation to and from the facility whenever it is necessary. The right to have the social and recreational activities of your choice. Question 36. Beneficence is defined as ______, doing good for others, speaking the truth consistently and dependably, keeping the matters of others private, not doing harm to others. Question 37. Which of these describes the job of an ombudsman committee? To investigate breaches of resident confidentiality, to investigate all complaints of resident abuse, to set the fees for the services a long-term care facility provides, to determine appropriate punishment for medical providers convicted of resident abuse. Question 38. What is the Ombudsman Committee? A group of concerned citizens who investigate all complaints of resident abuse. A committee of hospital administrators. A group of doctors who review patient records. A committee of family members of residents. Question 39. A resident is to be discharged from your facility for failure to pay for his care. According to the Resident's Bill of Rights, what is the proper amount of notice that he must be given? No notice is required. 7 days, 30 days, 60 days. Question 40. A patient's care plan indicates that she should be ambulated bid. How many times a day would ambulation be required? 3, 2, 1, 4. Question 41. There are certain steps to follow from start to finish when beginning a procedure on a patient. As a nursing assistant, it is extremely important to start with which of these tasks? Verify the resident's identification. Provide privacy in the immediate area. Enter the date in the patient's medical record. Document what you did. Question 42. What does the abbreviation NOC stand for? Night. No complaints. Nothing on chart. Normal Operations Center. Question 43. What does the abbreviation NKA stand for? No known allergies. No known ailments. Normal knee alignment. Never keep alone. Question 44. What does the abbreviation MN stand for? Midnight. Morning. Month. Main nurse. Question 45. What does the abbreviation NPO stand for? Nothing by mouth. New patient orientation. No physical output. Normal pulse only. Question 46. How often should a resident's total intake and output be documented in the medical record? Once a shift, at the end. Every time the resident has measurable output. Every 2 hours. Once a shift, in the middle. Question 47. What is the most likely diagnosis for a resident who cannot smell smoke, increases their use of sugar or salt on foods, asks for a magnifying glass to read, and asks for the volume to be turned up while watching television? Sensory deprivation, sensory overload, sensory impairment, sensory stimulation. Question 48. Which of these is most important when a resident is being initially admitted to a care facility? Religious beliefs require a spiritual leader to be present. The family should give all the information to avoid inaccuracies. Family members should keep the resident from being involved in admitting. The resident should have the opportunity to provide his or her own information. Question 49. The nurse has just told you that you left something important off the charting of a resident's input for the day. All of these should be included except ______. Afternoon tea. Lactate ringers being given intravenously. A protein bar snack. Toast with breakfast. Question 50. Which of these is not a primary reason for an indwelling catheter to be taped down? To reduce inflammation of urinary tissues. To signal to family members or visitors that it is not intended for removal. To provide psychological security to the resident. To secure and stabilize it to prevent accidental removal. Question 51. Which of these is a form of nonverbal communication that might send a poor message to a resident? Using an overtly loud voice when explaining yourself. Facing the resident and talking slowly. A curt voice when answering questions. Hands on the hips and pursed lips. Question 52. It is important to report which of these conversations between a CNA and a resident to ensure his or her safety and well-being. His or her favorite activities. His or her likes and dislikes. His or her specific requests. His or her favorite foods. Question 53. A resident tells you that he feels like he's got a lump in his chest. An example of clarifying the message he's communicated to you would be to ask him _______. Tell me more about that. Let me see if I understand what you mean. You feel like you have fullness in your chest. Are you having any palpitations or radiation of your symptoms? Do you feel pain? Question 54. A resident in your care is frustrated, upset, and raising his voice in complaint. Which of these is the best response to his actions? Offer support and care using a comforting and calming manner. Report the incident to the supervising nurse. Walk away from the patient in an effort to show you won't tolerate the behavior. Ask the resident to lower his voice in courtesy to other residents who are getting upset. Question 55. When a patient is dying, the last of the 5 senses the patient loses is touch, taste, sight, hearing. Question 56. A resident catches you off guard with a comment that is sexual. Your best response would be to ______. Walk away and pretend you did not hear it. Make a humorous comment in return. Change the conversation to a different subject. Let the resident know that the comment is not acceptable to you. Question 57. Which of these is not a normal biological change to the body from the aging process? The movement of food from the digestive system becomes slower. The ability to make decisions is weakened. Joints become stiffer and less flexible. Bones become thinner and less strong. Question 58. Which of these is not a common cause of constipation? An increase in intestinal motility. Ignoring the urge to go. Not drinking enough water. A low-fiber diet. Question 59. Which of these could cause a nursing assistant to be charged with battery? Ignoring or delaying a response to a resident's call for help. raising a hand to threaten a slap, administering medications, using restraints on a resident without a physician's order. Question 60. All of these could result in a nursing assistant being charged with negligence except not checking on a resident at a prescribed time, nicking the forehead of a resident while trimming their bangs, deliberately harming a resident with extreme force, not turning a patient every 2 hours as prescribed to prevent pressure sores. Question 61. Your fellow nursing assistant is angry at you and lies to the charge nurse. He claims you stole money from a resident's purse. This is an example of malpractice, defamation, assault, accolades. Question 62. Which of these is the legal term for being responsible for providing care according to an accepted standard? Liability, aiding and abetting, slander, legality. Question 63. You observe a coworker sexually harassing a resident and choose to ignore it. This is an example of cease and desist, passive aggression, libel, aiding and abetting. Question 64. When a nursing assistant restricts a resident's movements or actions without proper authorization, it can be interpreted as aiding and abetting, slander, liability, false imprisonment. Question 65. Which of these would be an example of invasion of a patient's privacy? Exposing the resident's body unnecessarily when performing his or her care, not knocking on the resident's door when entering the room, discussing the resident's dislikes with a coworker during report, not shutting the resident's door when exiting the room. Question 66. A resident has suffered a stroke. As a nursing assistant, you've been asked to help with ambulation. The best position for doing this would be in back of the resident, in front of the resident, on the resident's side that has been affected by the stroke, on the resident's side that is unaffected. Question 67. Which member of the resident's healthcare team is responsible for determining socialization and communication skills of residents and then finding the resources to match them? Social worker, chaplain, LPN, physician. Question 68. The nursing assistant walks in on a patient who is having a seizure. Which of these actions should the nursing assistant take first? Call for the doctor immediately. Restrain the patient so the patient does not harm himself/herself. Support the patient's head and move anything that could injure the patient. Place a padded tongue blade in the patient's mouth to keep the airway open. Question 69. Which of these best describes how accurate documentation assists the entire healthcare team? It is emphasized in training but rarely happens. It is a precautionary action primarily to defend a CNA. It is crucial for determining if interventions in the care plan are effective. It is more important to initiate conversations with residents. Question 70. Which of these members of the healthcare team is responsible for supervising UAP, unlicensed assistive personnel, MD or DO, physician, registered nurse, RN, certified nursing assistant, CNA, patient care assistant/technician, PCA/PCT. Question 71. You've been asked to increase a resident's muscle strength and joint mobility with passive range of motion exercises. The best example of this type of treatment would be using resistance exercises on a resident's arm, gently holding the resident's arm and smoothly moving it in a circular motion, having the resident lift small objects in short intervals, having the resident move the arm in a circular direction while you time short intervals. Question 72. An assisting device does not help with dressing, restraining, eating, moving around,